we hear so often, almost no medical education workshop or basic course workshop is complete without a session on microteaching. And I understand that in some departments, and please forgive me if I am making a wrong statement, but particularly physiology, for example, in their MD final examinations, they have a session on what they call microteaching. Now, when I ask the residents or the faculty to tell us what is their concept of microteaching, that is basically asking the PG to deliver a 5 to 7 minutes talk and then assessing him or her on various aspects of giving a lecture. And when we go to basic medical education workshops, then microteaching assumes a totally different dimension. And I'm sure all of you who have been through that experience can actually relate to what the concept of microteaching is, which we practice in our basic workshops. So today, and particularly why I picked up this topic, is that today we are going to examine the basic concept. We'll look at what has gone wrong, if I use that term, and we'll also look at how best we can make use of this extremely simple modality, which has a great potential to improve the quality of teaching for every level of faculty. Generally, it is said that micro teaching is for juniors, assistant professors and senior residents. They need to have micro teaching sessions. But I personally don't agree because when I learned a lot of new techniques and skills, for example, how to use a PowerPoint or how to make a PowerPoint, then I had to undergo these micro teaching sessions myself. Of course, they were not formal. They were kind of not involving too many faculty from my institution. But somebody as helpful, if I say that way, and cooperative, like my children, for example, they helped me to improve the quality of my slides and improve the quality of my presentations. So let's look at what is currently viewed as micro teaching and what should it be viewed as, so that we understand the differences and then we see how can we make best use of this modality. Interestingly, micro teaching was first described in 1969, Ellen and Ray. And if you look at the conceptualization or the earliest publication which they gave, then it was conceptualized as a real teaching. And note the word. It was not a simulated teaching. It was conceptualized as a real teaching where the complexities of normal classroom in terms of class size, scope of content, and time were all reduced. And that may provide you the answer that why this was called micro teaching. This was micro teaching because everything was micro. So whether it was the number of students or the content that was taught or the time, and most importantly, the complexities of the normal classroom. There are so many complexities which actually are difficult to put in words, which are actually difficult to define, but they exist. And anyone who has taken a lecture would realize that there are often issues which don't really get onto the surface, but they are there and they affect the quality of teaching that you impart. Now, as I said, micro refers to it being small. And so, micro teaching does not cover, or can we say, should not cover the entire spectrum of teaching. It should focus on specific teaching tasks. So, if I take some examples, it could be use of Blackboard, it could be use of PowerPoints, it could be use of questioning techniques in the class, it could be interactive teaching, that you practice in the class. So pick up a specific skill, and that is actually what gives you a better output from the micro teaching exercise. And why does that happen? Because it allows you to increase the control over your practice. And the most important point which comes is the feedback. And if you remember the talk on reflections that we had, I think 2 weeks ago, then feedback followed by reflection has been shown to be having the greatest influence on the improvement of performance. And that is what micro teaching actually exploits. So, feedback followed by reflections by the faculty concerned. So, in other words, it's a scaled down version of a real teaching session with less time, less content, less skills, and less audience. Now, when we say everything is less, then you would probably have doubts coming that you cannot have an entire topic being taught in a micro teaching session. Or other way around, you cannot infer the quality or content of a teaching during a micro teaching session. So micro teaching basically focuses on skills and not the total teaching skills, but specific skills which are identified, which the teacher feels need improvement, and they need to be picked up beforehand, because then your feedback has to be specifically directed to those particular skills. Now, what happens, and this is just a repetition for you because most of you must have seen this and practiced this in at least in practice sessions. So it provides an opportunity to the teachers to give a small sample of their teaching, get feedback from their peers, and re-practice the skill as required. And it's not a one-time process. It's an iterative cycle. So if you want to, for example, improve your skill of asking questions from the students in the classroom, then you request your peers to please come, observe how I doing it, give me some feedback. I reflect, I incorporate on that feedback in my actual practice. Next time, I modify my performance. And then I ask for feedback again. So it's an iterative cycle where you perform, feedback, reflection, reperform, then feedback, then reflection. And focus, as I have been repeatedly saying, is on improvement of an individual or sometimes a cluster of skills. Because when I say, for example, you have to look at my interactivity during a classroom teaching, then it may not be just one skill. Interactivity involves a lot of small, multiple skills which are integrated and nested with each other. So it could be either an individual skill or a cluster of skills which could be covered within a short span of 5 to 7 minutes. Now let's look at the strengths. One, that it uses the power of feedback. Further, it doesn't require too much of time. So 5 to 7 minutes of performance, another 5 to 7 minutes for feedback, and then reflection. So total 15 to 20 minutes may be good enough time. So if you have a departmental meeting, for example, and you say, okay, let's practice micro teaching today, then within an hour, when you finish a cup of tea, at least 3 teachers could have given the micro teaching sessions. So that is the strength of it. And then it also allows the teacher to use reflections to improve and to work on the feedback that they have received so that they can improve the skills, they can practice it again or re-practice it as often as required. Till you think, now I'm comfortable using interactive teaching, or I am now comfortable asking questions from the students. That's the time when you end. Although there's never an end where you can say, I'm the perfect. So it might still keep on happening that you would keep on improving your performance and the way you deliver a particular topic. So if we go by what Ellen and Ryan, the inventors of microteaching, what they described right in the beginning, then what you would say that it's a brief session. And the emphasis is on brief. Don't make it 1 hour micro teaching, because if you make it 1 hour, nobody is going to come to provide you feedback. Everybody is busy. Even you may not go to others' classes to provide feedback for 1 hour. Second, and this is probably the most important, and that is this all should happen in a safe environment. We'll elaborate on this part a little later. Third, you break your teaching behavior into small sub skills. So when you start your lecture, for example, you greet the class, you start some kind of a introduction to bring the class on the same wavelength as you are. You may deliver your talk, you may ask some questions, you may show some slides, you may show some models, etc., etc. So break your teaching skills into sub skills, and don't try to put everything at one. Don't say that in this particular session, I am demonstrating you 5 skills and you give me feedback. That would probably be counterproductive, because the time that we are allocating is only 5 to 7 minutes. So keep it one at a time, or at the most two at a time. Then it requires a focused feedback, encouragement from the group, and I hope you are able to relate it to the safe environment part that I said earlier, and an opportunity to practice and repractice. Now, conceptually, if you look at this model, it was excellent. In a safe environment, you give your demonstration for 5 minutes, ask people to provide you feedback, reflect on that feedback, make changes to your teaching methodology, give a demonstration again. Simple. But sometimes, you know, things don't appear so simple as they are thought to be. And I have been repeatedly emphasizing on this word, safe environment. We'll talk about it later. Now, since 1969, that is the time when it was first described and published, it has been used at several pre and in service training programs. The major focus of micro teaching actually has been in pre service programs. That means before you become a teacher. Now, since it was not specifically directed for medical teachers, so basically what it meant is that while somebody is doing, for example, a B.Ed, or somebody is doing an M.Ed, before he or she is appointed as a teacher, now that was a time when you would use micro teaching to improve your practical skill. In our setup, medical teachers, for example, when somebody is a junior resident or a senior resident, now that is the time when you would want to sharpen your teaching skills. So pre-service. And later, as the concept of faculty development came during National Teacher Training Center's time and FAMER programs and so on. Now that was the in-service training where micro teaching was adapted so that even existing teachers could benefit from the process, which I just described. But unfortunately, what happened that in a bid to make it more objective, people started creating checklists. And I'll show you some, but if you Google checklist for micro teaching, you would come across massive checklists, some of them containing as many as 60 to 70 items. Now imagine having only 5 minutes and having to put a tick box on a checklist having 70 items. You won't be listening to what the teacher is saying. You won't be really observing what it, because your whole focus is on completing the checklist. Second, people and most of these checklists actually incorporate the entire range of teaching behaviors. So while you may say my focus is on only interactivity in teaching, they'll say, oh, your language and your poise and your confidence and your questioning and so many other things. So they would rate you on everything, and so the thing would get diluted. So what you specifically want to improve actually got lost somewhere. So much so that one very senior professor described micro teaching as putting the teacher under microscope so that all the faults can be brought up. Now, that is, I think, what was the anticlimax. And so, what happened? That the concept of micro was taken away because you wanted to include as much as possible in the whole thing, in the hope that if one is bad, at least you will have a good point to counter your bad rating. And it became an exercise in fault finding. So, when I remember, and I hope some of you do that, when we had this session in teacher training workshops, it was particularly, the junior faculty who would enjoy finding faults of their seniors because that was the only time when they could pull their legs and get away with it. Now come back, safe environment. And what we transformed it into an exercise in fault finding. I sometimes give a very common example, and some of you or many of you may be able to relate to it. Suppose I have to go to a party and I get ready with all my new suit and shirt and tie, etc., etc. And I ask my wife, how am I looking? And she tells me, yeah, everything is all right. Only thing is this color of the tie and shirt are little odd. So can you change either change the tie or change the shirt? Okay, I do that and go for the party. Oh, but imagine if my wife was to say, you will never improve. What kind of a choice you have? Such a dirty shirt and such a dirty tie, and you don't even know how to wear the coat properly. And look at your shoes, they are so bad. Would I ever ask her again? No, probably never. So that fault finding and safe environment. And I'm reminded that when these IAS probationers go for their training, there are sessions kept for them where they have to make deliberate mistakes. Because fear of making mistake is something which prevents us from going further in life. So a safe environment where you can make mistake, not deliberately, but let it come out naturally from what you would have otherwise done in your classroom. And then somebody telling you how to improve that part of time. So this was a big issue. And so what happened is that over the years, 69 it started, and I suppose by 80s or so, it was on the verge of dying now. And dying because people started looking at micro teaching as putting the teacher under the microscope. And this was one of the cartoons which actually became very famous. I have read on it, so it may not be the original version, but everybody, you ask what is micro teaching, and they'll say, put the teacher under a microscope, look at all his faults. That was the keyword, look at all his faults. So what happened? People started shying away from micro teaching. They'll not go to micro teaching sessions because they knew that if I go there, somebody will pull my legs and I'll come back insulted and humiliated rather than getting some improvement in my teaching skills. So far, so good. But then changes happened. And if we look at the evolution of micro teaching, and this is what the checklist I was talking to you, even a teacher is neat and well groomed, and teacher is teacher's personality is strong enough to command respect and attention. What the kind of things which people would put in their checklist? No, unfortunately, many of these are things which are beyond my control. Somebody may say, if you were 6 inches longer, you would have been a better teacher. And that's ridiculous. Or if somebody were to say, if you had lost 10 kg weight, you would have been a better teacher. That doesn't make sense. And even otherwise, in classroom management, so the teacher has a systematic way of checking attendance, assignment, practical exercise. How do you do that? When you're taking a lecture, how do you check attendance? Except maybe taking attendance at the end. Or how do you check for navigating the virtual classroom? So you look at these checklists and you will realize that many of them actually were not feasible to be done within a period of 5 to 7 minutes that we had allotted for the original micro teaching exercise. Another problem with checklist is that, of course, they are inappropriately long and the content is also not really representative, but they presume that there is the way to teach. And everybody has to learn that way to be called a good teacher. Because if you don't follow the checklist, you are not considered a good teacher. And then actually it created a lot of issues. I had one of our famous fellows when he sat for giving a demonstration of micro teaching. So he told me, sir, when I started, I got a checklist, and the first item on the checklist was starts the class with a joke. Now, that's a problem. He said, I had to teach neonatology and I couldn't think of a joke related to a neonate. So he did a lot of literature search and Google search and blah, blah, blah. And then he came out with the idea. So a baby was born and then he asked the nurse, where am I born? And the nurse said in Ludhiana. So said, oh, no, again, Chole Bhature. Now, that is what you are starting your neonatology class as. Because you have to start with a joke. Even if you search out a better joke, you know, it would still be inappropriate. And please remember, at least I am very comfortable cracking jokes with the audience which is unknown. You have a friend circle, you can crack jokes. But to a group of 150 students who don't even know you well, and you come and start cracking a joke, that would be anticlimax of your teaching session. And then some parts were considered better than others. And it was also realized that you put everything together and you get out a good teacher. So if you have a personality like in the checklist, or if you have a control over your neatness and well groomed, so you become a better teacher. The focus became on thoroughness. And that is the problem with checklist. We have actually seen this problem happening with OSCE versus long case presentation. And I hope you have read out those reports which very categorically demonstrated that experts generally score less on a OSCE as compared to students because they don't go into those minute details. They can make a diagnosis with a much shorter history and much shorter examination. But that doesn't mean that they are not good clinicians or they lack competence. And so we only looked at how many in the checklist were performed. And this resulted in our failure to distinguish effective from mediocre. So the only thing was that the senior teachers and professors, they prescribed everybody in the department will have 3 sessions per year. So people had. But what was the content? What did they learn? Was probably nobody's concern. And around that time, some other changes were also seen. For example, video recordings. So they would make a video and both teacher and student would sit together and watch those videos. There were one-way mirrors put on. So the seniors from this side could see what junior is doing, but he couldn't see the other way around. So he was not even sure if somebody is watching him or not watching him. And this caught fancy, particularly in many developed nations and those who had a lot of resources. So institutions which had videos and which had one-way mirrors, they started doing this way. And unfortunately, resource poor settings. And most of the colleges in our country would actually fall in resource poor setting, especially those in the government setup. They had no money for one-way mirrors and video recordings for this kind of activity. They would rather put a video in the operation theater than to put it in the class. And this resulted in alienation. And this alienation was more acute in resource poor settings. Now look at how many factors have accumulated. So you are trying to act like a big boss. I'm senior, so I know better. You better learn from me. One. Second, you are looking at only one and only one way of teaching. If you don't do this way, you are not a good teacher. You are looking at an exercise in fault finding. Uh, some of you might have heard the name of Professor Daljit Singh. He was principal of Dayanand Medical College and later vice chancellor of Sri Guru Ramdas University. So he was telling me once when he was freshly got admitted to a medical college. So the rumor was that he was a very good singer. So they asked him to sing. So he sang a song. Then he asked him sing again. And sang a song. And sing again. So 4, 5, 6 times this happened. And he finally asked, sir, पांच तो गा दिए और कितने गाऊं? So the seniors told him, जब तक अच्छा नहीं गाओगे गाते रहो. And same thing actually happened in the microteaching. You were never satisfied with the performance of your junior. Keep on doing, keep on doing, keep on doing till you become perfect. All this resulted in alienation. Nobody, howsoever junior he or she may be, would actually want this kind of a treatment in the department that somebody is watching you either through one-way mirror or with a video recording and then, trying to point out mistakes, what you have committed. So this actually resulted in further loss of microteaching. And so what happened? That in pre-service, this was probably continued because B.Ed, people doing B.Ed, for example, were still not actual teachers. They were going to be teachers. So they had to do because it was a part of the course requirement, so it had to be done. But use for in-service training was actually highly curtailed for these reasons, exactly for these reasons. Seniors will not do it because it would expose them to juniors pulling their legs. And juniors will not do it because it will kind of show their weaknesses to the seniors that they don't even know this, they don't even know this. And when people also try to bring in the content into it. So in 5 minutes, they, suppose they are teaching malnutrition. 5 minutes, they'll try to put everything about malnutrition. So that actually took away all the purposes of micro teaching that was described. Now, there is something which I want to share with you, and this is called a technology adoption model. Suppose somebody was to give a new technology tomorrow, that with this you can track so and so where he or she is. It's not that immediately you'll start your phone and do immediately, or some other technology, for example. So there are two important things which actually come into operation before you start using a new technology. And although this says technology adoption model, but it's very well applicable to many of other things in life. And what it includes, the first thing the person decides is the perceived usefulness. Is it useful for me for all the time effort that I'm going to put? Will it be useful? And second is the perceived ease of use. If it is easy to do, you would do. Even though you perceive it as useful, but it is complicated to do, probably you will not. And what happened with micro teaching is actually here only the opinion got divided. Although people might have seen it as a useful technique, but then the ease of use was not there. You arrange videos and you arrange one-way class, and then you have 1 hour sessions and checklist photocopies and so on and so on. And therefore, the use was not really the way we wanted it to be used in our classrooms. Now comes the interesting part. Most often what happens in science, I would say, that A discovers a process or a mechanism or a theme, and then it is used for some time, and people are not happy with that. So B comes out with a modification. That's the usual thing to happen. But interestingly, in case of micro teaching, it was the Allen and Wang themselves from their first report of 1969 in 1996. They themselves wrote, having seen the papers and publications that had come out on this topic, that its complexity overwhelmed its effectiveness as a training device and its use declined over time. So that's the interesting part. And then what they suggested? They suggested that we should further scale down the details. Don't go into those minute things like a checklist or 10 people watching somebody and so on and so on. Make it less complicated, make it less dependent on technology, and gear it towards in-service training. So it is not that only before you become a teacher, you need to do micro teaching. Rather, even after becoming a teacher, you need to be practicing micro teaching to improve your teaching skills and teaching quality. So it was rightly called the 21st century micro teaching. And what was the change which happened is that 4 to 5 teachers would come together. So I, for example, want to know how are my slides and can I make them better. So I would request 4 or 5 quote and unquote friends, who are willing to spend that much time and who are going to give me feedback without pulling my leg. So that trust became important. And the checklist were replaced by what is called 2+2 protocol. Now, what is this 2+2 protocol? After my small talk of 5 to 7 minutes, each one will give 2 things that I did well and 2 things which need improvement. And if, for example, you had 5 people sitting in the group, so I am presenting, 4 are there observing me and giving me feedback. So at the end of this 5 minutes, I'll have 8 comments telling me what I did well and 8 comments about what I should be improving in my subsequent teaching sessions. And the requirement to reteach, in original micro teaching, you had to reteach immediately. There was no time to reflect on your performance. Here, reteaching was made optional. So you got the feedback, you go, reflect, digest, assimilate, and then decide what all you need to incorporate out of that feedback and what all you need to discard out of that feedback. And then recently, last 10 years or so, another version. Version 3 has also come. And what is this version 3? That it is actually initiated by the trainee. So rather than HOD telling, come, give me a micro teaching, it's other way around. No, I go to him or her and say, ma'am, I want to learn more about my skills of interactive teaching. So can you please give me 5 minutes? Now, what happens in this model? And all of us have mobile phones now these days. So the teacher would give a performance, and 1 out of the 4 or 5 who are sitting there would make a recording of the teaching. What is happening? At the end of it, you would hand over that phone to the person who was giving the performance and ask her to look at her performance as recorded and then give comments what she feels. Can you identify what we are doing actually? The Pendleton's model of providing feedback. So you are first asking the person to give comments on his or her own performance. And once that person actually says, I did not use clear language or I was not audible to people sitting at the back, then the receptivity to change becomes better. If somebody was to tell me your voice is not audible, I'll say mic ठीक नहीं था, internet connection was not all right, this thing was bad, that thing was. I'll not own that mistake. But if I start myself, I felt that at times I was going low, so people may not have been able to listen to me. Then probably the things will become different. And from behaviorist, that is, this is the way. We actually moved on to the cognitivist. No, you look at it, you think about it, then you decide what is the way to teach. Make use of reflections, and that is something which we discussed in detail last time. And it actually follows the accepted models of teacher development. That's how we all develop. No, nobody has become a teacher by having a senior teacher on your breathing on your neck and then giving you feedback about how to improve and how not to improve. So it becomes less threatening because first you are reviewing your own performance. So in all probabilities, you have yourself picked up your faults. It reinforces correct behaviors. It encourages reflection. It's less technology dependent. Everybody has a mobile phone, so you don't need any additional technology. It is shown to improve the self-efficacy beliefs of the teacher. And these self-efficacy beliefs are the key factors. Unless you think, yes, I can do, you will not do it. It's just like, the story of Hanumanji. He had to jump over the sea to go to Sri Lanka. And he said, नहीं, मैं तो नहीं जा सकता. And then, a lot of people and friends had to come and tell him, no, no, you can do. And then he did. So this self-efficacy belief is the key factor in actually deciding your performance. And as I said earlier, it uses the power of feedback, and add one more to it, it uses the power of reflections. One more thing which you add here is the power of feed forward. When we were discussing competency-based assessment, we discussed about feed forward. So in future, if you have a similar situation, how differently you should have done. When you say feedback, you are only looking at what has happened. You should have done that, you should have done that, you should have done that. But when you say feed forward, then you are saying next time do it like this. And that's probably more effective as compared to only giving feedback. Many times people get confused. Should we look at content or no? My strong answer is no. Because in 5 minutes, you cannot assess content. If somebody has to teach you enteric fever in 1 hour, now in 5 minutes, you can't assess what content he or she is going to include. So from that perspective, actually micro teaching is like a net practice. Whereas actual teaching is like a match. So when players are doing net practice, they don't look at how many wickets and how many runs and how many fours and how many sixes. No. The purpose is only learn how to deal with different kinds of ball, and then hope that you will be able to use these learning when you actually go out to practice. And this difference is crucial. If you do not keep this in mind, then you will end up playing a match onto a net practice or vice versa. Both would be disastrous. So look at micro teaching as a net practice where the purpose is to improve yourself. The purpose is to learn new techniques, new tricks, new ways to deal with unprecedented situations rather than actually performing. The actual performing comes only when you are in the classroom. This I have already said, so I'll not elaborate more on that. The current version now stands like this, that the presenter first says how she found the experience. She says if the learning was achieved, then observers say what they learned and what they felt, and no advice is given. Mind that. You just give suggestions. no prescriptions. It's for the person to decide whether to use it or do not. And don't ask, rather actively avoid to be defensive. Sometimes it may happen. Somebody may say you were not audible. And don't start saying mic was not all right, connection was not right. Okay, thank you. The only thing actually which you should say in response to feedback, any feedback for that matter, is just thank you. Go back home, replay in your mind, think over it again, and then decide what to do. Not because simply somebody told you to do like this, you have to change your behavior. I'll be happy to answer any questions that the audience may have. So thank you for being with me. I notice we have a yes. Please identify yourself and then start your
So
question.
myself, Dr. Gurleen.
हाँ बोलिए.
Pharmacology. Sir, I want to ask that is this the reason the previous BCW was included? It had the session on micro session, but now in the newer the revised basic course, they don't have this micro teaching session now.
Well, there are many reasons.
Is the importance being undermined?
Yeah, that's what I'm saying. There are many reasons for that. In fact, I was the one who decided the program for the in that group which decided the program for the new basic course. So what we felt is that since this micro teaching has been going on for quite some time now, so people probably know about it already. And there were more important topics like skills and reflections and logbooks and DLs and so on, which had to be included. Since the time is limited, so you have to prioritize what you need to include. But if I have to do a faculty development program independent of CPME, then I would definitely include micro teaching. Now, since the purpose in revised basic and modified basic is to actually prepare the faculty for competency based. So that is the reason some pick and choose was done, and this was it.
Sir, second question is, does micro teaching ends with giving the feedback, or it also includes giving the teacher takes that feedback and then presents again?
Well, as I said, in the new model, this reteaching is not necessary. So you do not want the teacher to immediately reteach because you have not provided time for her to reflect on it, to think about it. You may say something. For example, I may not agree with the suggestions that you are giving.
Yes, sir.
People say your slides are too blank, just white background, nothing else. Why don't you use a colorful background and use some animations, etc., etc.? Well, thank you for the feedback, but I know that I'm not going to change my slides because I feel that they look much better in a dark or even in a lighted room. And there are so many other things, even about, like I started with telling a joke. I have to be careful, in the middle of my lecture, somewhere after having built some rapport with the class, I might give a small joke. But to come and start with a joke, is something which I would not venture, especially if the audience is not well known to me. So that's why reteach is actually not encouraged because you provide the feedback and then allow the person concerned to reflect, to digest, assimilate, think, and then decide whether to adopt the new behavior or to continue doing it the old way.
Okay, sir. Thank you.
Sir, this is Sushant sir from Rajahmundry.
Anji.
Sir, I've seen in micro teaching sessions, so many drama goes on, and the assessors, as I told you, we have to create a safe environment. There I've seen the assessors many times they want to deliberately make some disturbance or create some distraction so that they want to assess the competency where the student will bring the classroom into order. So can we, will it be a good idea to put those competencies or in the I mean, classroom management and all these things in the micro teaching session itself?
Yes, you can do. The only thing is that, as said in one of my slides, that the new micro teaching is actually trainee initiated. So I have to be convinced that this is what I need to improve. That's the first thing to change. If I'm not convinced that I need to change, then any amount of feedback is not going to help me. Secondly, even the observers should be invited by the trainee. Rather than HOD saying XYZ is going to be observer, then it starts a difficult process. And all this drama of leg pulling and humiliating people actually starts. So I know I can trust these 4, 5, 6 people to give me good feedback. So I invite those people. And then there is no leg pulling like that happening. And all that actually they do is to put all those 2 plus 2 good points and those that need improvement on a piece of paper, give it to me. I keep those papers with me, take them home. Any number of times, I can look at them, I can think about them, I can reflect on them. So everything actually comes on me as a trainee, not on people who are giving me feedbacks. Because ultimately it is I who have to change. And unless I am willing to change, nothing will change.
So that means that will create the safe environment.
Safe environment is that when somebody is giving you feedback, he is not ridiculing you. He or she is giving a good suggestion. I think in my suggestion, or if I was in your place, I would have done that. That kind of a thing. Rather than you don't even know this, what kind of a teacher you are. The moment you start saying this, then you take away the safe
Yeah.
environment. And then people are not willing to. And you have seen, see, after all, like Gulin said, there were so many basic course workshops where micro teaching was part of the session. Tell me how many institutions and how many faculty have actually done a micro teaching session for the sake of learning. For sake of demonstration, yes, they may have done. But for the sake of learning, how many have done? Probably not.
No. Yes, sir. Thank you, sir.
Any other questions? Okay, so if there are no more questions, then we'll end the topic. So thank you very much for being with me. And Dr. Pramod will shortly announce the next in this series. So thank you very much and goodbye.
Thank you, sir.
Thank you so much, sir.